Good evening, Team Kentucky. This is Lieutenant Governor Jacqueline Coleman kicking us off today, and I want to let you know that it is a pretty packed hour. We have a lot to get through today, so I'm going to start with some good news items. We are nearly 1 year into this COVID-19 pandemic, and so many Kentuckians are still struggling with the economic impact of the pandemic, which is why earlier Governor Beshear announced the Healthy at Home Eviction Relief Fund. And this follows our earlier efforts to make sure that Kentuckians are able to stay in their homes, but we also can provide relief to landlords and to our utility companies. So this program is a partnership with the Kentucky Housing Corporation, and it's utilizing a portion of the $297 million of federal coronavirus relief funds that the Commonwealth recently received. And I'm happy to report that this fund is off to a great start. There have been over 8,500 applications started, and more than 4,700 applications have already been completed. So as a reminder, Lexington and Louisville have their own direct grants for this program. So if you live in Fayette County, the website that you need to go to seek eviction relief is COVID-19renterhelp.org. And if you are in Jefferson County, your website is stopmyeviction.org. For all of the other 118 counties in Kentucky, go to teamkyhherf.ky.gov. So there's some exciting news about all three programs. Tenants can apply for assistance with rent dating back to April 2020 and for 3 months into the future. Those applying through the Team Kentucky portal can also get help paying utility bills and up to 12 months of past due bills and 3 months of future payments as well. These programs will provide significant relief for Kentuckians and help with bills leading us into the future and out of this pandemic. But we need both landlords and tenants to apply online. There are some federal guidelines that both renters and landlords must meet, and those details are on the website at teamkyhherf.ky.gov. Last year, Team Kentucky helped 4,135 households avoid eviction with nearly $15 million in assistance. This year, we want to do more because these are our neighbors, our friends, our family members, and they are asking for help. I received a story about a family from Clark County with a son who has special needs and a parent battling cancer, and they had no idea how they were going to make ends meet until the landlord posted some information about the Healthy at Home Eviction Relief Fund on their door. And they didn't know if they would qualify or not, but they went ahead and applied. And to quote the recipient, she said, "I remember on the day I found out I got it, I cried. It was amazing. It was like a weight had been lifted off me. It was life-changing for us. It's hard when you have to decide between paying food and paying for rent." So the Beshear Coleman administration is committed to helping keep Kentuckians safe and healthy from COVID-19. We are also committed to making sure that families like this have help because they have been financially hurt during this pandemic. Okay, so next up, we have a special open enrollment for healthcare. We believe that access, of course, to quality and affordable health insurance is a right for every Kentuckian. And COVID-19 has made us more aware of that than ever. Expanded care has helped us to prevent more deaths than most other states. President Biden has signed an executive order that activated a special 3-month healthcare enrollment period, which started February 15th and will last until May 15th. The special enrollment period is for Americans to get quality, affordable health care coverage through their state's health insurance marketplace. This is great news for all Kentuckians. I encourage every Kentuckian without coverage to take advantage of this opportunity. For currently uninsured Kentuckians, many may qualify for financial help to pay for health coverage or free coverage through Medicaid or the Children's Health Insurance Program, also known as CHIP. Kentuckians may begin enrolling in several ways. First, you can visit healthcare.gov and submit an application or update an application that has already been started. Help is also available by visiting Connect or KYNECT a one-stop portal for finding health coverage and other benefits. The site is run by the Cabinet for Health and Family Services. Kentuckians can also call 1-855-459-6328 for assistance. And lastly, another option is contacting a health insurance agent currently licensed in Kentucky. Last but not least, we have the Kentucky Broadband Initiative. Our administration is also committed to making sure that we can provide broadband internet connectivity for every single Kentuckian. Closing the digital divide is critical for economic development, for making sure that we can build jobs of the future, to build a stronger economy for Kentucky. So I'm happy to report that we have registered over 61,000 tests so far. In order to get as many people across Kentucky to take this test, we are extending the deadline to March 1st. We need everyone, no matter where you live, to make sure that you participate. The speed test is the very first step in bringing internet connectivity to every Kentuckian. It takes 30 seconds and it's completely anonymous. We will take this data and we will build a map of Kentucky highlighting the areas that are most in need of broadband. And once that mapping is complete, we will partner with both public and private partners to bring fast, reliable internet connectivity to the areas that are most in need. So the website that you can visit to take the speed test is speedtest.ky.gov. And that wraps it up for the good news today. And so I'm going to turn it over to Governor Beshear.
Well, thank you to Lieutenant Governor Coleman for the good news. It's important that we hear it, that we focus on it, that we celebrate it, and that it helps get us through some of these tougher times. I want to start today on the weather, which has hit us hard during this last week plus. And as we so often have over the last year, Kentuckians have pulled together over these last 8 days during these 3 winter storms. People are looking out for their neighbors. Our transportation cabinet is out there clearing roads and removing debris, working around the clock. And the National Guard and state troopers are providing wellness checks in some of our hardest hit areas. We now have over 80 National Guard men and women in numerous eastern Kentucky counties, and increased that number yesterday after specific requests from county judges and others. I want those that have been hit hardest in eastern Kentucky to know that we are with them and they are not alone. And we will continue to provide help in every way that we can. Got the opportunity yesterday to visit a warming center out in Boyd County. Individuals who were there had been brought from all over, some by the National Guard, some by King's Daughter, and others. It was the community truly coming together, providing a warm place for people to be. And you could tell that it was appreciated. I mean, everybody in that center was out of their house, out of their home, and that had to be hard. But they were cared for, and we're committed to getting them up and running as quickly as we can. Division of Forestry crews are out clearing down trees in high-impact areas. And teams with power companies have worked in these extreme conditions to get power on in people's homes. They've now restored power to more than half of those Kentucky customers who were impacted by power loss. Electricity has been restored to approximately 85,000 customers after outages peaked at 154,000. That's substantial progress, but a lot more work needs to be done until power is restored to every Kentuckian who has lost it. Tomorrow afternoon, Kentucky State Police will fly Kentucky Power employees to Eastern Kentucky to provide more manpower in power restoration efforts. Thanks to all these partners and public servants for being a part of Team Kentucky and helping us get through this storm together. Got to talk yesterday with numerous mayors, county judges, and others who are out there themselves trying to clear off these roads, trying to help restore power. Their leadership is so critical and so appreciated. Got to see nurses coming into the warming center to help individuals with medical needs. Just a true community coming together and all of Team Kentucky is with you. The weather is going to begin to taper off tonight, but there will still be work to clear roadways and restore power. Also, the temperatures are going to be very cold, so please be careful. Some roadways are still hazardous. There's still the potential for frostbite and hypothermia. And please, if you are heating your home with a generator or a charcoal grill, do not bring it in the garage. Do not bring it in your house. It needs to be at least 20 feet away from your home. We lose people to carbon monoxide poisoning every major storm we have, and it is absolutely avoidable. So if you know your neighbors are heating their home or providing electricity that way, please check on them. Make sure that they know. Make sure that they have the information they need to stay safe. Emergency Management Director Michael Dossett will now update you on the response, followed by an update on road conditions from Transportation Secretary Jim Gray.
Thank you, Governor. State Emergency Operations Center is at a level 3 for recovery operations. And I'll first talk very briefly about our efforts. There are 39 community warming centers now open, and we're looking toward 7 shelters. The Emergency Operations Center has provided heater meals, bottled water, and cots to our impact counties where they're needed. We have 9 utility cooperatives and hundreds of mutual aid linemen working as quickly as possible to restore the power to the remaining just under 74,000 homes. As the governor indicated, this is still a very dangerous situation for our counties out in the eastern and southeastern parts of the state. So we'll talk a little bit about the outage slide. There are 10 primary counties that still have lost power. You can see those in the purple area. Some of those include Boyd, Carter, Lawrence, Pulaski, Johnson, Rockcastle, Laurel, Greenup, Martin, Jackson, and Elliott. These counties were literally devastated with the outage, and there still remains a lot of work to do. There are countless individuals and teams that have worked for several days to assist our counties in needs. Let's take a moment to thank them all for their tireless efforts. They include our county judge executives, our mayors, our community leaders, and many, many, many volunteers. Our private sector partners, the Red Cross, members of Team Kentucky, the Transportation Cabinet, who've worked not only in storm remediation, but also to keep us moving in our thoroughfares and across the state. The Office of Energy Policy, the Public Service Commission, the Environmental Emergency Response Team, our Kentucky Rural Water Association, the Division of Water, our Kentucky National Guard, the Kentucky State Police, the Fire Commission, the Department of Public Health, and the Division of Emergency Management. Now into the weather. So we caught a glancing blow overnight with some additional snow and sleet. Some areas of the state received 2 to 4 inches of snow. So today's theme is better times are coming our way. We've come out of this storm system and temperatures are warming for the weekend. Tonight and tomorrow will be bitterly cold. So please stay safe. And again, all our thanks to the volunteers and all of our agencies that have supported this recovery effort. Back to you, Governor.
Now we'll go to Secretary Jim Gray from the Transportation Cabinet for an update on our roads.
Governor, thank you. And Governor, thank you also for thanking everyone that's been involved in this, what I would describe as this project, this crisis and the recovery now. And Director Dossett, you did a great job of illustrating it just now. There's no I in teamwork. Now, let me bring up to date on the transportation, on the work of the more than 2,000 employees of the Transportation Department of Highways. Precipitation has let up in most places, and it's allowed our crews and our contractors to make some real progress on clearing our roadways. It also gives them a chance to catch up, and you'll see it right here, catch up on maintenance work. This is a photo taken today of one of our mechanics working on a snowplow in the Louisville District 5. Majority of our highway districts are still treating and plowing. The top priority remains our A routes. Those are the interstates and the parkways. Districts are increasingly reporting that they're now able to get to the B and C routes as well. In eastern Kentucky, work continues to clear fallen trees and power lines, and our crews have to deal with their own loss of power in some of our maintenance facilities. Right here's a good example in the challenge that's remaining before us. It shows images in Jackson County of downed powered lines and trees breaking under the weight of the ice. These are the examples. So the snow may be tapering off, Governor, but we're not in the clear by any means. About 2/3 of the state remains under a winter storm warning. We're especially on the lookout for freezing drizzle today and overnight, one of the most treacherous forms of winter weather. So what are we urging the public to do? We're urging the public to continue to limit travel when they can. If you must go out, allow for extra time to get where you're going. Drive slowly. Watch out for our snow plows and our salt trucks, please. And please be patient. Check out our website for information, snowky.ky.gov, and follow us on Twitter and Facebook and Instagram. Back to you, Governor. Thank you.
Thank you, Director Dossett, Secretary Gray, and everybody out there doing the hard work to dig us out. And we are a tough people. We've been through this before. And we're going to make it, but we're going to make it because we take care of one another. And so for every family out there that's taken another family in, good for you. Thanks for living out your faith and your values and being there for folks when they need your help. All right, some updated guidance today that I know people have been waiting for a long time, and that's visitation guidance to some of our long-term care facilities. So for non-certified facilities, and that's important, that includes assisted living, personal care home, ICF, IDDs, and independent living, indoor visitation will resume for those that have been through the full vaccination process. That means that in those facilities, and there are facilities that aren't included in this list, that there can be additional outside visitation coming in and seeing your loved ones. And I know that that has been difficult for a long time. Group activities and communal dining will also resume again for those who have been fully vaccinated, and visitation amongst residents will resume for vaccinated residents. What this means is once someone is better protected from this disease, we want them to be able to see their loved ones. Again, this doesn't apply to the highest level of care facilities yet. There's still some CMS guidance on that, but for a little bit more, I want to turn it over to Adam Mather to further explain what I know is really good news for those that have wanted to visit their loved ones for a long time now.
Hey, Governor. I just want to start by thanking the families and residents for their patience during this pandemic. I know it's been a long journey, and certainly as excited as the governor to be able to announce that we can relax some of the restrictions that have been in place. I do want to reiterate something that I think is extremely important, that this relaxation of restrictions applies to non-Medicare certified long-term care facilities. And I think the governor explained what those facilities include. We are still waiting for a change in guidance from CMS for those Medicare certified facilities. And then thanks to the quick vaccination efforts by Walgreens and CVS, this has led us to be able to relax the indoor visitation, communal dining, and group activities. And so we're very appreciative of their swift efforts and ability to make this happen. And we do have a couple caveats to this. We do ask that all visitors are scheduled with the facility. And this is really an effort to avoid mass gatherings. So we're asking that these visits are limited to at least one visitor or two individuals from the same household. In addition, while you're visiting the facility, you will be screened at the door, as well as would need to present a negative COVID test or show proof of your vaccination. And we are asking that all visitors continue with basic precautions, and those include wearing a mask, proper hand hygiene, and social distancing when possible. And the guidance in depth will be posted tomorrow on the Cabinet for Health and Family Services Office of Inspector General website. And again, Governor, thank you for allowing me to share this information. We're certainly excited to see families get to see their loved ones. And I'm sure their loved ones are excited to be able to get to see their families. Thank you. I'll turn it back over to you.
And Adam, that test, the negative COVID test, that needs to be what, within 72 hours of the visit?
Yes, Governor, that's correct.
Okay.
Yes,
So
Governor,
folks,
that's
again, thank you. This is starting to relax what have been steps that were needed to take to protect those that are the most vulnerable. Remember, they don't apply to every facility because some of them we have to wait for CMS, that's the federal Medicaid regulatory body, to give us guidance on that. But we are doing what we can on the state side to provide more visitation to those that have been fully vaccinated. Again, as we emerge from this pandemic, we hope to be able to relax that further, but some really good news today. All right, on our COVID report, it's our typical good and bad news. Low cases, but high number of deaths. We're seeing that in a number of states. So today we're reporting 963 new cases of COVID-19 for a Thursday. That's the lowest day, I believe, since October the 8th. Our hospitalization, ICU, and ventilator numbers are all pretty stable. Our positivity rate has gone up a little bit to 7.07%, but this is an impact of the weather. This week, the weather has really hit testing. Testing is significantly down this week as opposed to last week. It's both good and bad. We'd like testing to be up this week, but what it tells us is it's definitely weather related and not people just not getting tested anymore. We had a gradual decline, but still a healthy number of tests last week and the week before, but certainly the weather is now impacting us. We believe that's what's going on with the positivity rate, that those that are truly sick, more likely to test positive, that are symptomatic, still get tested because they're seeking medical care. But we don't have as many asymptomatic people that come in. So testing is key. So we get through this weather, moving into next week, we need people to get back to their normal habits and getting regularly tested. It both protects you and your family, and it gives us critical information we need in the state. It gives us the best data to make the best decisions. Today, we do have 37 new deaths. If there is a bright spot, only 17 of them are long-term care residents. Remember, that number would have been much higher before vaccination efforts, and some of these individuals passed away certainly before there was an opportunity to get through the full course of vaccinations. We have an 83-year-old woman from Barron County, 90-year-old woman from Breckenridge, 71-year-old woman, and an 84-year-old man from Bullitt. Caldwell County, a 71-year-old woman and a 71-year-old man, a 60-year-old woman from Casey County, a 40-year-old woman from Christian County, a 68-year-old woman, and a 43-year-old man, and a 70-year-old man, all from Fayette County. In Floyd County, we lost a 73-year-old man. In Graves County, a 72-year-old man. In Hardin County, an 80-year-old man. In Henry County, a 54-year-old man. In Hopkins County, a 63-year-old man. In Jefferson County, 2 women, ages 71 and 82, and men ages 63, 78, 82, 87, and 93. A 101-year-old woman in Kenton, a 73-year-old woman in Lee, a 64-year-old woman in Logan, a a 60-year-old woman in McCreary, a 77-year-old woman, an 84-year-old man in Marshall, along with an 87-year-old man in Marshall, 64-year-old woman in Monroe, 69-year-old woman in Muhlenberg, a 79-year-old woman from Shelby County, a 60-year-old woman and a 67-year-old woman, both from Spencer County. In Todd County, we lost an 86-year-old woman, and in Warren County, a 70-year-old woman. Long-term care facilities, again, we are seeing progress. Just 8 new residents testing positive, 10 new staff, 7 new deaths attributable to long-term care residents, 1 new facility with at least 1 new positive case. All right, let's turn to vaccinations, which is the good news. And if you could put the overall chart up, we got some additional information for you, which gives us a better picture of the total number of Kentuckians that have been vaccinated. Oh, that's coming later. That's the maps. All right. What you can see here is we have now provided the first dose to at least 555,373 Kentuckians. That is really good news. That's north of 500,000, and we still have a long way to go. Now, the couple of pieces of information here. You see the state program there. That's certainly been impacted by weather, but just today, as of 3 o'clock, we'd had 1,300 people vaccinated at the Kentucky Horse Park operation with Kroger yesterday in Frankfort, 454. There were only about 50 appointments we had to reschedule because of weather. So it's picking back up. We're going to catch back up, but we're going to do everything we can to keep every center open as long as people can get there. Couple new things you see on this slide. Long-term care program. We have now been through every opportunity to get a first dose. So what you'll see is that neither of these numbers will grow moving into the future because there were those 3 visits and you could get your first dose on visit 1 or visit 2 at any facility, and those 2 visits have been completed. When you look at the slide, we also have our first numbers from the federal pharmacy program, which in its first week has provided 7,164 vaccines. Now, there has been a supply interruption because of weather. A number of the Moderna shipments haven't arrived this week. That appears to be a nationwide issue. So the federal pharmacies, for instance, haven't gotten the second allocation that's coming in, which I believe was a doubling either this week or next. And it may cause some supply issues at some of our regional sites, especially the new ones that we are going to announce today, potentially for Monday, but the sites can advise you on that. Again, this is short term. We can make up for it. We are built to provide a lot more vaccine. Listen, the weather is the weather, but we're going to push through. We're going to make sure we get these shots in people's arms as quickly as we can. So with today's additions, beginning next week, we will have 291 vaccination sites open across Kentucky. Regional sites, there will be 51 starting next week. They include 6 new regional sites. There you go. And let's go to the next slide, which lists the new regional sites. Okay, they are in the Medical Center at Albany in Clinton, the Ohio County Hospital, Taylor Regional Hospital in Taylor County, Buffalo Trace Health Department in Mason County, Trigg County Hospital, and the Crittenden Community Hospital. You can, appointments are required. Go back at all of these. You can get the information for how to contact and schedule appointments at vaccine.ky.gov. All right, non-regional Kroger sites, we now have 20. They include 10 new stores. The 10 new stores are in Pulaski, Hopkins, Oldham, Rowan, Nelson, Montgomery, Jefferson, Boone, Davis, and Marion counties. You can schedule those through the Kroger.com/COVID vaccine. Specific addresses of the locations are on our website, vaccine.ky.gov. Walmart locations now up to 25. They include 10 new sites in Caldwell, Campbell, Fulton, Grayson, Logan, Nelson, Mercer, Hopkins, Boyd, and Pulaski. And federally qualified health centers, we have 9 locations, and they include those in Rockcastle and in Jackson counties. We have 61 local health departments, and through the federal pharmacy program, which includes Walgreens and independent local pharmacies, there are another 125 locations that have vaccine as well. Now we have new maps to show you as we continue to grow our vaccine efforts. Let's start where we were on February 1st. All right, so this was building out our regional sites, and we asked you to be patient, at least a couple weeks patient, as we grow them. Let's add the sites for February 8th. This was us growing. And add the new regional sites for February 15th. All right, and then the new regional sites for February 22nd. And then let's go to map 5, which adds non-regional Kroger Walmart sites, the non-regional FQHC sites, the non-regional Kroger Walmart sites just from today, and the new non-regional FQHC sites. And then let's move to the map that has our local health departments. Let's end with map 7 that has the federally supplied pharmacy sites. All right, as you can see, this is our last one, right? As you can see, we have built this map out significantly. There is a provider that has vaccine close to where everybody lives in the Commonwealth. There's some areas where we might have to drive just a little bit further, but we continue to build this out. Now, these are a lot of providers. And while I'm very excited about the 57% increase in vaccines we've gotten over the last 3 to 4 weeks, remember, we need more supply. We don't have nearly what we could put in people's arms. And every time we add sites, and we add them for convenience, it does split up the pie in more and more amounts, which means there may be more and more phone numbers to call, and providers will have limited amounts. Now, I know that might be frustrating, that in many ways we wish you could just call one number, but the reason we have to do this is we expect significant additional supply in March and as we move into the summer. So what we're building, if you go back to the map, isn't meant for the amount of supply we have now. It's meant for the day that we get so much in that we can get everybody through. And I hope a record rapid time to get everybody vaccinated. We're building for the future, and our infrastructure is way ahead of supply. But I hope everybody sees the plan and the why we have to do it. It may cause convenient. It'll be more convenient in terms of where you have to go to get it. It may be more inconvenient for the different ways to sign up. But this is what's required when we want to provide significant amounts of vaccine, hundreds and hundreds of thousands, in very short order when we get that opportunity. All right. I think with that, we're ready to go over to Amy Cubbage, who has an update on UI for us.
Thank you, Governor. I just want to start out with some good news about our numbers. From the beginning of the pandemic through December 31st, we can tell you that we now have 82% of those claims that we received, we were able to pay, with about 8% being denied, which means a total of about 90% have been resolved. That does leave about 10% that are pending still, though the vast majority of the claims that are still pending are from the last quarter of the year, which again is good news. And only about 45% of those we believe have fraud issues. So we are running at about 45,000 that still have pending issues without fraud issues as of December 31st. So we're very happy with those numbers in light of the 1.6 million claims from about 650,000 people that we got through the end of 2020. Just a few notes about virtual appointments. I know that we wish we could offer more of those, and we know those get snapped up quickly. But there have been some questions out there about people missing their appointments, people not getting calls. Please know that we make every effort during the time you are scheduled to contact you. We have to contact you based on the phone number that is on your UI claim. If you don't answer the first time, we will call one more time. Then we send you an email at the email associated with the claim, and that's for security reasons to make sure that we are not talking about your sensitive financial data with anyone else. If you get that email, the only information that is in that is just you had an appointment, please contact us. We ask for you to email us back that day, and we will still fit you in that day. If you missed your appointment for some reason, if we don't hear from you by the end of the day, then you would need to make another appointment. Also know too, if a staff person is out because they are sick or for whatever reason, we have backups that step in. So there's never an issue with our staff not being able to make those calls. And just so you know how successful this is, while we know we get reports of people not receiving their calls or missing their calls, last week we pulled the data and 89% of our we were able to reach 89% of the people who had phone appointments. So please know that we wish we could have many, many more, but look for those appointments as they open up, and we will get you those calls out to you. Now, I know we've mentioned the debit card issue and that we've moved over to paper checks. Please, again, if you have that old debit card, spend everything off of it by February 28th. But I think we may have a slide on this. If you have received a paper check in error, please send that back to the Office of Unemployment Insurance, attention BPC, 500 Merrow Street, 4th floor, Frankfort, Kentucky, 40601. Include your name and some contact information, but not your social security number, and a message that you did not file and you believe you received the check in error. And OUI will contact you about options for getting those charges reversed. And that's now up on the screen. That address and information is also available at the kcc.ky.gov website. So again, if you got a paper check and you shouldn't have received it, please send it back to this address. Don't just rip it up, because we need an audit trail to show how we ended up voiding that. Now, a couple of comments about the increased fraud levels. The fraud related to the pandemic-related program called PUA is now at epidemic proportions across the country. And just so you understand the levels we're talking about, for January, our number of claims that are flagged as unresolved that have ID issues, in other words, they may be fraudulent claims, are actually 75% of the claims filed in January, which far eclipses our average over the pandemic. So we are putting new measures in place to try to sort those claims out so that we aren't fully overwhelmed and distracted by those claims, so we can work on the claims of actual honest-to-goodness Kentuckians who need their benefits. So for now, all out-of-state claims have a stop on them. PUA claims are normally supposed to be made in the state where you live. So we have a flood of claims by people with out-of-state addresses. So we have a stop on those unless they can be verified. We are also updating a fraud form on the KCC website. So if you believe you have received a fraudulent letter or have been a victim of UI fraud, you will next week be able to just fill out a form on the web page as opposed to having to email. When these situations happen, staff does put a stop on the claim, whether it's reported by you or we notice it. And if we review it and believe it's fraudulent, they will reach out to you to confirm. Also know if imposters have filed a claim in Kentucky under your name, that they are probably being filed in multiple states. These claims, there's a lot of information out, are a form of organized crime, and they're being filed as mass claims. So they file in every state that they can possibly think to file in to see if they're going to get a hit. So if you believe you've been a victim of this, there are some recommendations on the KCC website if you believe your identity has been stolen. And there is increased law enforcement activity investigating this. So hopefully we'll see some prosecutions or at least some other law enforcement activity in the coming months to try to tamp down this, since it really does put a strain on the system. And for those who are curious what the letters look like, I don't know if you'll be able to see it in the slide, but we have a slide of actually the fraudulent letter that I've received, just so you know what it looks like when you receive it. When you look at this letter, it says benefit determination for pandemic unemployment assistance. That does not mean any money has been paid. If you get one of these letters, all that means is a claim has been filed. So in my case here, you can see it's got my name on it. Whoever filed the claim didn't actually upload any identity documents. So no money was ever paid out on this claim. This claim had what was called a stop on it. So if you get one of these letters in error, don't be immediately afraid that a claim has been paid in your name. You can check either, you can email the UI fraud at ky.gov email, or you can go to the website and next week and fill out that form, and we'll take care of that. Last, just want to give you some good news about the new interface that we're hoping to roll out soon. We did the beta testing with claimants yesterday. So far, we're getting good feedback. Once we get all of that and determine if we need to make any changes, we're going to launch the new interface. Again, this is only an overlay on the old computer system. This isn't going to take away all of the problems related to it, but we hope it will make it at least a little more user-friendly for you when you either file an initial claim or try to claim benefits. We are getting close to the end of the review for the RFP for a new UI system, and hopefully in a couple of weeks we'll have some updates on that as well. And that's it for today.
All right, we have 11 journalists that have joined us. We'll start with Stu Johnson from WEKU.
Thank you, Governor. Good afternoon. Going back to your comments on testing today, you mentioned that testing because of the weather had declined some. You said it even prior to the weather had fallen some. Is there a concern that the testing has been down enough to be reflected in the cases being reported, that fewer cases are being reported?
Well, we believe that testing was down a little bit, gradual in the preceding weeks, but not enough to make a significant impact on our data. I think our testing is still healthier as compared to some other states, but this week it may well have an impact. We'll have to watch what happens next week, but it is really down this week. We do need to continue to encourage people to get tested. Again, I don't think previous weeks have been impacted by this, but this week, or maybe even moving into next week, probably will be. Karen Czar from WUKY.
Governor, I apologize. I had connectivity issues on my end earlier. So if you already answered this, just let me know and you can move forward. I can go back and get it. But we talked earlier this week that today and then again next week will be a test run because more people are being vaccinated because of those additional appointments. How did you feel that went? And if someone couldn't make it in today because of the weather, what should they do to get another appointment? Thank you.
We went over quickly in Frankfurt yesterday. We only had about 10% that needed to reschedule. And for the regional sites we're doing with Kroger, you can go to your confirmation email if you can't make it and click a button, click a link to reschedule. That's what everybody should do. Today at the horse park, we were over 1,300 vaccinations as of 3 o'clock. So we think we're going to hit a large majority of those too. But again, go to your email that confirms, and there is a link to reschedule. We want to get you in. We want to make sure you get vaccinated. If you're in the groups that we are servicing right now, then hopefully we can get you in quickly. On a real positive note, I got a chance to walk around and to talk to people in that warming station in Ashland. And with the exception of about one individual who'd been a little bit hesitant, just about everybody over 70 in that warming station had been vaccinated. So I know folks in that area have been doing a really good job, but that was a good thing to see and to hear. John Boyle from WFPL.
Hi, Governor. We had a question about the eviction relief. So from the sound of it, it sounds like both renters and landlords have to fill out forms for this to work. But as I'm sure you guys know, a lot of times those relationships and the communication can be shaky at best. So we wanted to know if, what avenues are there for people that don't have necessarily cooperative landlords?
John, that's a good question that we'll need to get a way to address. I'll talk with the Kentucky Housing Corporation and see what ability they have for those that are finding that challenge, and the ability for them to reach out. I mean, this is an opportunity that no one should turn down. It's an opportunity for the renter to get out of debt and to even get some rent paid going forward. And it's a chance for the landlord to get paid. But you're right, there are communication issues sometimes. Now, the avenue that we'll work towards won't apply to Louisville. They're running their own program, but it's a good point and one that we should address. Tom Latek from Kentucky Today.
There we go. Good afternoon, Governor. Are we at a point yet? This is going back to the weather, if I may. Are we at a point yet where emergency management is able to collate all the damage information and what have you to be able to apply for a disaster declaration soon? And what is the damage threshold these days to qualify?
So it takes significant time to get all the information in to calculate whether or not we would qualify for a disaster declaration. We currently believe that we will hit that threshold, but Tom, I'd add that most of the time it takes more than 30 days, even in a flooding event, to get that information. And our state of emergency in the state has to be active that entire period of time. That would mean in some regular emergencies where we want that reimbursement from the federal government, if Senate Bill 1 stays in effect, we'd have to have a $300,000 plus special session just to keep a state of emergency open where we're collecting information to get reimbursement. Do we have Director Dossett still? Okay, we'll get you that exact threshold. I want to make sure we get you the right number. It's significant, but we have a significant amount of damage in this storm. Sarah Ladd from the Courier-Journal.
Thank you. Good afternoon. A recent teachers union survey here in Louisville found more than half of educators think it's best to finish the year virtually, even after their vaccinations are complete. What is your reaction to that finding, given that teachers were prioritized so we could reopen schools? And do you think their hesitation to reopen schools are founded? Thank you.
I think the discussion with our teachers needs to be specific. And right now it has been broad. And I believe that once everybody is vaccinated, there should be an in-person option of some sort in every school district. But what that looks like depends on the challenges that the district is facing. If you look at the new CDC information, they talk about density. And that can be density in the classroom or density in busing. Jefferson County faces challenges in both. They talk about what the age of the buildings, which would be the ventilation and the ability to social distance, might mean. And so I believe, the communication here needs to be how the district intends to create the right environment given those considerations. A lot of people just read that top line and they say the CDC says reopen schools, but then there are 20 extra pages. And yes, after vaccinations, I believe that we can do this safely. I believe we should do this safely. But I think to build confidence, which is what we should also want, we should want our teachers going in confident that they need a real specific plan on the extra steps that have to be taken. Universal masking, density reduction. In Jefferson County, that may well be a hybrid program that's necessary. And I believe once the discussion is on those grounds and scientific information is provided, it'll be a very different discussion. I know so many of our educators want to get back to the classroom. I think if they're given a specific plan, they're going to be excited to do it. One that is fully explained, one that puts everybody's safety first. Scott Brown from WKDZ.
Thank you, Governor. Good news today with the addition of more regional vaccination sites in the western part of the state. Before today, some state and local leaders had expressed some frustration to us about the lack of those sites in western Kentucky, especially given the fact that there's only 15 Kroger stores in western Kentucky and there's only 17 cities that have a Walgreens, and none of the regional FQHC sites are in western Kentucky. Why did there seem to be such a disparity in regional vaccination sites for western Kentucky, given that there was twice as many in the eastern part of the state, which is also considered to be a rural area of the state? Thank you.
Well, first, I just want to make sure we clarify that number of sites are different from amount of vaccine that gets to a certain area. There was a Western Kentucky legislator who was concerned about the amount several weeks ago. And when we looked at the area, it was about 5% of the state's population. It got about 13% of the vaccine in the early part of the rollout. So we are continuing to work to make sure we get the vaccine out per the population. We actually argued with and won the argument with the federal government to add the local community pharmacies to the Walgreens in the federal pharmacy program. And a lot of those are in Western Kentucky. Certain parts of Western Kentucky have a whole lot of options right now, Paducah being one. One of the challenges here is that, every mayor wants to fight for a facility in their town. Every county judge wants as much of it as possible, and in many ways don't think it's their job about how much the next county has. The state, we've got to try to build a fair and equitable distribution that is on a statewide basis. So there are different kind of pushes and pulls and pressures. But I can guarantee the citizens of Western Kentucky that we're getting them the vaccine. We're going to continue to build this out. All of the federally qualified community health centers, the federal program, all chosen by the federal government, are in Eastern Kentucky. But you're going to continue to see it built out, and we're going to make sure we have vaccine for you. Now, one of the reasons we do regional sites as well as these local sites is that, number one, it's more efficient. We can track the vaccine better. We can ensure that none of it is wasted. But second, it's also a little more transparent in who gets the appointments and making sure we're serving those that need it the most. But we're building this thing out statewide, and the purpose is when we get a ton of this, we want to make sure that we can get it in people's arms as quickly as possible. Melissa Patrick from Kentucky Health News.
Hi, Governor. So I had asked for a breakdown by age of the inmates who are 60 and older. What I was provided was those who are 50 and older. and which is about 16% of the prison population. So anyway, I have two questions. One is, when will the state prisoners or inmates, especially those 60 and older, get vaccinated? And second, do you think is there any reason to think that they already have herd immunity because so many of the inmates have been infected?
Let me grab something that's being handed to me. Okay. I think I have a little bit more information on the numbers for you. So I think we currently have 9,547 inmates in our state prisons. There are 181 70 and older. Our hope is that we can start vaccinating them as we move to 1C for the general public. There are 214 between the ages of 65 and 69, and 431 between the ages of 60 and 64. The herd immunity question is a good question. It's one we hadn't necessarily thought about. Now, in our vaccination efforts, we're encouraging everybody to be vaccinated, even if they have had COVID. We are certainly seeing across the nation some reinfections, and with variants out there, even if COVID has gone through our prison system, when we turn and vaccinate those in those facilities at on a broader level, we're going to want to make sure we get everybody who's willing to take the vaccine. But those 181 that are 70 and older, our hope is that we can get those vaccinations done. Here once we move to 1C in the broader population. Also, we continue to work to get corrections officers vaccinated to provide that extra layer of protection for the inmates. Joe Ragusa from Spectrum News 1.
Hi, Governor. So I want to ask about the hearing today in regards to the lawsuit challenging House Bill 1, Senate Bill 1, and Senate Bill 2. I wanted to get your just general thoughts on today's testimony, if you got the chance to really see any of it or hear any of what was discussed today in court. And I also wanted to ask about the possible deadline that might be coming up, at least my understanding and the court's understanding from what it sounded like. As far as Senate Bill 1, it sounds like early March might be a day that could be considered a possible deadline to have some of these executive orders either renewed or some sort of action on them. What's your understanding of that, and how concerned are you? It sounded like the judge wanted to make an issue or make an order before that deadline, but how concerned are you about that and what it means for the coronavirus orders?
Under Senate Bill 1, in early March, every single executive order and or regulation we've put out to protect people, to provide dollars to our schools for virtual learning, all the executive orders put in place to try to protect people would be invalidated. At that point, it would require the legislature to agree to a whole new set of rules, or perhaps to those same set of rules, but they wouldn't have passed Senate Bill 1 if they agreed with the rules that we put into place. So it is critical that we get a ruling before then, or the Senate and the House agree to continue what we have in place. It's worked. We're in the bottom 10 in death per capita in the country. That's saving lives. That means that it's working. I wasn't able to watch a lot of the testimony today. I do appreciate Dr. Stack and others living through it. I was advised that at one point the Attorney General's office argued against our mask mandate, claiming that it didn't work. I mean, folks, just because numbers were going up and we put in a mask mandate doesn't mean it didn't work. It absolutely does. And the fact that we've got one of our constitutional offices still challenging the most basic of science and fighting this pandemic is really concerning. And it suggests, without enjoining Senate Bill 1 and Senate Bill 2 and House Bill 1, we won't even have a mask mandate, which is so critical. And I think every Kentuckian can imagine what it'd be like walking through, first of all, a facility that has no capacity limitations and nobody's wearing masks when we are about to beat this virus. We got to be more responsible than that. Piper Hudspeth Blackburn from the Associated Press.
Thanks, Governor. Is there an estimate or of a current number of how many teachers and school staff that have been vaccinated? And if so, how is the state getting to this number or this ballpark estimate, since the way school districts are even keeping track of these vaccinations are not the same throughout the state? Thank you.
We'll get you the number. The number we have would be the number from the program we initiated with each superintendent. That is, the superintendent went to, it's more than teachers, it's educators in and around the building, got the specific list of individuals willing to be a part of the program, and we sent that very specific number of vaccines out. What that doesn't mean, though, is that some that said no have since gotten vaccinated through a different facility or a different program. But the number we'll send you is very specific from what was requested in vaccines from each superintendent, where there was an individual that had said yes associated with each vaccine that went out there. I think we are right now going through most of the second doses. We certainly think that everybody who signed up will be fully vaccinated, at the very least the second or the third week of March, with the vast majority having both doses by the first week of March. David Winter from WKRC Local 12 to close us out.
All right, thanks for taking the question, Governor. FEMA in August was authorized to provide $44 billion to states in lost wages assistance funds. That was the $400 a week in direct payments. Kentucky got about $230 million of that. There are Kentuckians who applied for the LWA funds through Kentucky's Office of Unemployment Insurance, but they were denied for one reason or another. Some of them appealed and they won, but we're told all of those funds have now been distributed and are depleted. They are owed thousands of dollars. Should the state make accommodations for these people?
I'm going to turn this one over to Amy Cubbage. Certainly, and I'll let her respond to what's available through the federal program, but any additional payments for unemployment would take legislative action, at least in our current state law system. Amy?
Unfortunately, the way that program was set up and worked is once the funds were depleted, even if people later became eligible for the funds, that was it. Now we are exploring whether or not there is an opportunity to request additional funds to cover some of the people who have now become eligible, but the way that the FEMA program and the governing documents and statute worked with that is there was never a guarantee that everyone who ultimately became available for those funds would get payments because of the way that unique program worked. It's not like the $600 supplement earlier in 2020 or the $300 supplement now. So it was a very confusing and it was very difficult program to administer. Unfortunately, it has caused issues like this, but we very much wanted to try to bring as many of the benefits as we could to Kentuckians. So we hate that there are people out there in this situation. We're exploring whether there is an ability to get additional funding from FEMA, but the way the program worked is if the money ran out, the money ran out. And that's the unfortunate fact of how that program is.
And Amy, that was the only program like that ran through FEMA, correct?
That's right.
With the original, yeah, and so we've got both the opportunity to talk to FEMA about it, and then we've got another, CARES type act moving through Congress right now.
That's right.
Okay. Then we've got at least two opportunities to try to right that wrong. That was a very difficult program. Remember, we put $100 into that. Many states chose not to do it at all because of the challenges that it created. So we made the decision to move ahead. knowing that there could be problems, knowing that there could be some issues that don't seem fair, but without having done it, those dollars that we were able to get out to so many Kentuckians wouldn't have gotten out there. Coming back to Tom Latek, the threshold for Kentucky for that federal assistance is $6,726,019. Everybody, I appreciate the hard work you were doing this week, whether it's digging out of these winter storms or wearing your masks. We are getting people vaccinated at rates faster than the federal government can provide us the vaccines. And if we can just continue to do the right things to protect one another, we're going to get through this, and we're going to get through it together. We'll be back Monday at 4 p.m. Thanks.